Golden retrievers are not quiet dogs. You know this. You have known it since the first day they came home. The whining when you pick up your keys, the bark at the doorbell, and then the bark at the echo of the doorbell. The way they follow you from room to room and somehow always manage to be slightly underfoot. The happy, ridiculous, relentless energy that fills a house so completely that you forget what silence even felt like before they arrived. Which is exactly why the day it changes stops you cold. You walk in the door and they do not come. You call their name and they lift their head from across the room, but they do not get up. You sit next to them and they lean into you, but quietly, in a way that feels less like affection and more like something you cannot name, but cannot ignore either. Most owners tell themselves their dog is just tired, just having an off day, just getting older, and sometimes that is true. But in Golden Retrievers specifically, sudden quietness, a withdrawal from the personality that defines them, is one of the most consistent early signals that something inside their body has shifted. And today I need to walk you through exactly what that something could be. Because in this breed, more than almost any other, early attention to that signal changes everything. Hi everyone, I'm Dr. Naomi, your neighborhood veterinarian, and welcome back to the channel. Before we get into the specific causes, I want to address something directly, because I think it is the most important thing I will say in this entire video. Golden retrievers are extraordinary at hiding how they feel. This is not a coincidence. It is a deeply embedded instinct that goes back thousands of years of evolution, when showing weakness or pain in the wild meant becoming a target. Dogs did not evolve in a world where hiding illness was dangerous. They evolved in a world where showing it was. And golden retrievers, who have been bred specifically for their eagerness to please, their sensitivity to their owner's emotional state, and their instinct to remain happy and present for the people they love, take this hiding tendency further than almost any other breed I work with. What this means in practice is that by the time a golden retriever's behavior changes enough for you to notice, by the time the quietness is undeniable, the underlying cause has often been developing for longer than you would expect. Weeks in some cases, months in others. Your job as their owner is not to wait until the signal becomes impossible to ignore. Your job is to take it seriously the first time you feel it. And today, I am going to give you the knowledge to do exactly that. The first and most important cause I need to talk about is the one that defines this breed medically more than any other single fact about them. Cancer. I do not say that word lightly, and I do not say it to frighten you without purpose. I say it because golden retrievers have the highest cancer rate of any dog breed in the world. Studies consistently show that over 60% of golden retrievers will develop cancer in their lifetime, and it is the leading cause of death in the breed by a significant margin. The types of cancer most commonly seen in Goldens include hemangiosarcoma, which affects the spleen, liver, and heart lining, lymphoma, which affects the lymphatic system throughout the body, osteosarcoma, which affects the bones, and mast cell tumors, which affect the skin and internal organs. What all of these have in common in their early stages is that they are frequently invisible to the naked eye, and their first symptom is often nothing more specific than a change in energy and personality. A dog who seems quieter, less interested, less themselves. I had a 7-year-old male golden retriever named Arthur come into my clinic. His owner, a woman who had owned Goldens her entire adult life, described him as having been slightly off for about 3 weeks. Not dramatically sick, not refusing food, not limping. Just quieter than usual and less excited about his morning walks than he had always been. Something in her gut told her to come in rather than wait. We ran a full wellness panel and performed an abdominal ultrasound. Arthur had a mass on his spleen that we would never have felt on physical examination alone. We referred him immediately for surgery, and the mass was removed before it had the opportunity to rupture, which in hemangiosarcoma is the event that turns a survivable situation into a catastrophic one. Arthur's owner's instinct to act on a subtle behavioral change rather than explain it away almost certainly saved his life. The correct approach for every golden retriever owner is annual wellness blood work starting at age 5, and ideally a baseline abdominal ultrasound at the same age, performed by a veterinary internist or radiologist. This is not standard in most wellness visits, and you may need to ask for it specifically. The blood work alone will not catch hemangiosarcoma or early lymphoma, but it provides a baseline that makes any future change in values meaningful, and it catches other concurrent issues that may be contributing to the behavior change. If your golden is over 6 years old and suddenly seems quieter, less engaged, or less like themselves, please do not wait for a scheduled wellness visit. Call your vet this week and describe what you are seeing. A behavioral change in an older golden is a reason for a prompt appointment, not a reason to monitor at home for another month. The second cause of sudden quietness in golden retrievers is one that is frequently missed for months because its early symptoms are so gradual and so easily attributed to other things. Hypothyroidism. The thyroid gland, which sits in the neck on either side of the trachea, is responsible for producing hormones that regulate the body's metabolic rate, essentially the speed at which every cell in the body operates. When the thyroid gland becomes underactive and produces insufficient hormone, the entire body slows down. Energy levels drop. Mental sharpness decreases. The dog becomes quieter, less reactive, less enthusiastic, and often gains weight despite no change in food intake. The coat frequently changes as well, becoming dull, dry, and thinning in patches, particularly along the flanks and tail. Golden retrievers are one of the breeds with the highest genetic predisposition to hypothyroidism, and it most commonly develops between the ages of 4 and 10. I had a 5-year-old female golden named Honey whose owner came in frustrated because she had noticed Honey gaining weight despite cutting her food back significantly over the previous 4 months. Honey had also become noticeably less playful and tended to seek out warm spots in the house, which the owner had assumed was just a preference. On examination, Honey's coat along her sides was notably thinner than the dense double coat a healthy golden should have, and her energy during the physical exam was subdued in a way that felt medical rather than temperamental. A thyroid panel confirmed low T4 levels consistent with hypothyroidism. Honey was started on a daily oral thyroid supplement called levothyroxine, which is an inexpensive and highly effective medication given once or twice daily with food. Within 6 weeks, her owner reported that Honey was back to her normal self in a way that made the previous 4 months of gradual decline suddenly visible in retrospect. The correct approach is to specifically request a full thyroid panel, not just a T4 level, from your vet if your golden has been gaining weight, seems lethargic, or has coat changes alongside the behavioral shift. A basic thyroid screen is included in most senior wellness panels, but a full panel that includes free T4 and TSH gives a much more accurate picture. The third cause is one that every dog owner should know by name, but that golden retriever owners specifically need to have memorized, because large and deep-chested breeds like goldens are among the highest risk groups for it. It is called gastric dilatation volvulus, or GDV, and it is more commonly known as bloat. GDV is a condition where the stomach fills with gas and then rotates on its own axis, twisting the entrance and exit of the stomach closed simultaneously. The trapped gas has nowhere to go. The stomach expands rapidly and begins pressing on the large blood vessels that return blood to the heart, cutting off circulation to the organs. GDV is one of the few conditions in veterinary medicine that can kill an otherwise healthy dog in a matter of hours, and it is a genuine emergency every single time. The reason I am including it in a video about sudden quietness is that GDV does not always announce itself with the dramatic symptoms owners expect. Yes, it can present with violent retching and a visibly distended abdomen, but in its early stages, before the full rotation has occurred or in the early period after it has, a dog may simply seem profoundly uncomfortable and withdrawn, restless but quiet, unwilling to settle but not able to explain why. I had an 8-year-old male golden named Samson whose owner called me in the early evening saying Samson had eaten his dinner 2 hours earlier and now seemed strange, not himself, pacing slightly, not interested in his evening walk, and his belly looked perhaps a little rounder than usual, but she wasn't sure. I told her to come in immediately. Samson was in the early stages of GDV. We were in surgery within 45 minutes. If she had waited until morning, he would not have survived. The correct response to a golden retriever who seems suddenly restless, uncomfortable, quiet, and uninterested in normal activity within 1 to 4 hours of eating, especially if their abdomen appears distended or if they are attempting to vomit without producing anything, is to treat it as an emergency and go to the nearest veterinary facility right now, regardless of the time. There is a preventative surgical procedure called a gastropexy, where the stomach is tacked to the abdominal wall to prevent rotation, that can be performed at the time of spay or neuter or as a standalone procedure. If you have an intact or recently neutered large male golden over the age of 5, ask your vet whether prophylactic gastropexy is appropriate to discuss. The fourth cause of sudden quietness is one that lives in the intersection between what we can see and what we cannot, and that is pain. Dogs, and golden retrievers in particular, with their deeply ingrained desire to please, are extraordinarily skilled at masking pain in ways that would be impossible for a human to sustain. A golden in significant pain will still wag their tail when you walk in the room. They will still accept a treat. They will still lean against you and let you stroke them. What they will stop doing is initiating. They will stop bouncing to the door. They will stop bringing you toys. They will stop doing the things that require them to move through the pain voluntarily, because while they will endure pain to make you happy, they will not seek out additional movement that worsens it without a reason. I had a 6-year-old golden named Maple who was brought in because her owner said she had stopped playing fetch, which had been her singular obsession since puppyhood. She would still eat, still greet visitors, still wag enthusiastically when her owner came home. But the ball sat untouched in the yard for 2 weeks. On examination, I found significant early arthritis in both of Maple's rear hip joints, confirmed on X-ray. She was in consistent pain during any activity that required extension of those joints, which fetch demands repeatedly. Her owner had not seen limping because Maple had adapted her movement to minimize the worst of it. Pain management and a joint support protocol changed Maple's life within a month. If your golden has quietly stopped doing one specific thing they used to love, that specificity is actually important diagnostic information. Bring it to your vet's attention precisely. Not just that they seem quieter, but that they stopped doing this particular thing at this particular time. That level of detail points us toward the right area of the body much faster than a general observation alone. The fifth and final cause I want to cover today is one that sits in a different category from the others, but is equally important to recognize: emotional and psychological withdrawal. Golden retrievers are one of the most emotionally sensitive breeds that exists. They attune to their household's emotional climate with a degree of precision that still surprises me after years of practice. Significant stress in the home, a major routine disruption, the loss of another pet or a family member, a move, a new baby, extended time alone, all of these can produce genuine behavioral depression in a golden retriever that looks almost identical to the physical causes we have discussed: the quietness, the reduced engagement, the willingness to be near you without actively participating. The difference is in the timeline and the accompanying physical signs. Emotional withdrawal in Goldens tends to develop in clear correlation with a specific change or event. Does not typically come with physical symptoms like weight changes, coat changes, or abdominal changes, and often responds visibly to increased enrichment, consistent routine, and quality time. The correct approach, if you suspect emotional withdrawal rather than a physical cause, is to first rule out the physical causes with a vet visit, because emotional withdrawal is a diagnosis of exclusion, meaning we confirm it by confirming that nothing medical is driving the behavior. Once physical causes are ruled out, structured daily enrichment becomes the prescription. Consistent walk times, puzzle feeders, new scent experiences in the yard or on walks, and in some cases the introduction of supervised socialization with familiar dogs can meaningfully lift a golden's mood within 2 to 3 weeks. If the withdrawal is severe, prolonged, or accompanied by changes in appetite, do not try to manage it at home without veterinary guidance, because the line between behavioral depression and the early stages of a physical illness is not always clear and is not something you should try to diagnose alone. Here is what I want every golden retriever owner to carry with you after today. You know your dog. You know their specific brand of noise and enthusiasm and presence better than any veterinarian ever will. That knowledge is not a small thing. It is the most powerful early diagnostic tool your dog has access to, and it lives entirely with you. When something shifts, when the house feels slightly different, when they do not come to the door, when the morning excitement is missing, when they lean against you quietly instead of bouncing around you loudly, trust that feeling. Write down exactly what you are noticing and when it started. Think about whether anything changed around that time. Think about whether it is one specific behavior that stopped or a general flattening of their whole personality. And then call your vet with that information rather than waiting to see if it resolves on its own. Cancer caught in week 3 looks completely different from cancer caught in month 4. Hypothyroidism treated at the first signs of lethargy causes a fraction of the long-term metabolic disruption of hypothyroidism managed after a year of unnoticed decline. GDV survived is a dog who gets to come home. The window between noticing and acting is the most important window in your golden retriever's health. Which of these causes surprised you most today? Tell me in the comments. And if you have a golden who has gone through something like this, I genuinely want to hear your story. Your experience might be exactly what another owner reading those comments needs to hear to finally make the call they have been putting off. If this video gave you something important today, please hit the like button. It costs you nothing, and it puts this information in front of the golden retriever owners who need it right now. Subscribe so you are here for the next one. Give your dog a gentle scratch behind the ears for Dr. Naomi. Stay safe. Always trust your instincts, and I will see you all in the very next video.